Hello, dear friends, and welcome to today's very special event. We are so grateful you've taken time out of your day to be here with us. This month is extra special because we have just launched a free section on our eLotus course site dedicated to our beloved Dr. Richard Tan, his balance method acupuncture, and his most popular acupuncture prescriptions. Also included on our course site are over 300 master tongue points, over 200 auricular points, scalp points, wrist and ankle acupuncture, and abdominal acupuncture, all for free so we can learn together. To celebrate Dr. Tan's lifetime achievements, every Thursday of September at this time, we have planned a special 1-hour teaching from Dr. Tan for us to watch together. It's our way of honoring him, remembering his joy, and continuing to spread the incredible healing system he gifted us all. Thank you for being here to carry his work forward. eLotus is honored to have been Dr. Tan's chosen partner in carrying forward his legacy, sharing his transformative seminars through video, and preserving his invaluable teachings for practitioners around the world. We would also like to acknowledge Evergreen Herbs, today's sponsor of this free webinar, and Dr. Tan's exclusive herb supplier for his clinic from 2003 until his passing. In addition to Dr. Tan's free videos this month, we also invite you to explore our clinical manual of Oriental medicine. Inside, you'll find nearly 100 of Dr. Tan's balance method acupuncture protocols for the most common disorders you encounter in clinical practice. Alongside Dr. Tan's points, the manual also includes master tongue points, Dr. Li Chun Huang's auricular prescriptions, and Dr. Jimmy Chang's proven herbal formulas, all in one place to help you choose the best protocols for treating both your everyday and most challenging patients. I will include details in the chat room shortly. And now, without further ado, let's begin. Hi again, everyone. Before we begin, we had a lot of questions on how to access Dr. Tan's treatment protocol section. So I'm going to give a quick demonstration so you can easily navigate through our site and find his most valued $1 million protocols, which, yes, you might have guessed, made him millions of dollars. I imagine you can too. Let me show you how to access Dr. Tan's 40 years of experience on our website. As you can see, I'm on our eLotus homepage. And at the top of the page, next to where it says Continuing Education, I'm going to click on Core. Core is the free section of our website where we list a collection of real essentials for your practice. No theoretical stuff. Everything listed is 100% practical and effective information that delivers real results. Now that I'm in the course site, to navigate to Dr. Tan's section, I'm going to click on Explore More. And then I'm going to click on Overview. This page is then organized into 3 sections. There are details about the balance method, his top prescriptions, his biography, his courses, and our Gold Pass. To learn more about each section, click on the white or purple buttons and it will take you to a new page. Now let's go back up to the first section of this page and click Discover More. Here we have a summary explaining the balance method as well as each section of the page outlined for you at the top. Here you can see the overview, step 1, step 2, visuals of the 5 systems, a chart of the 5 systems, and also a feature which shows the integrated master tongue points with the balance method meridians. And then step 3, which provides you the mirroring and reverse mirroring charts, 4 imaging charts, as well as a chart of the hologram theory, all laid out so you can quickly reference it wherever you are. At the end of the page, you'll also see that we included a case study for a patient with lateral knee pain. If you scroll down a little further, you can also enter the $1 million combos page here. And of course, beneath that, you can see that any course purchased or accessed through our webinar weekdays provides access to our clinical manual with the top 100 protocols for the top 100 of the most common disorders you see in the clinic, all created by Dr. Tan himself. The login information can be found on the blue course access pages of your active courses. Now, let's check out Dr. Tan's $1 Million Combos and other special protocols by clicking on Explore Balance Method Prescriptions. If you're not logged in, a blue message will pop up. Simply click Log In and enter your account information. You will then be directed back to the home page, but you can quickly access this page again by clicking Core, Explore More, and Treatment Protocols. On this page, you will see a huge list of Dr. Tan's most famous protocols, including his $1 Million Combo protocols, which literally made him $1 million. For Dr. Tan's $1 Million Combo for back pain, you can see which points to needle on the left side, right side, as well as the indications, actions, and needling techniques to help you get immediate, jaw-dropping immediate results. You can also use the filters on the left if you're looking for something more specific. Let's take a look at the emotional, psychological, and mental filter. Here we can see 5 protocols for different circumstances. Let's view the 8 magical points for Shen disturbance. Here you can also see which points to needle on the left side, right side, the indications, actions, and the needling techniques as well. Feel free to explore this section and master these protocols. If you want to learn more about Dr. Tan and all of his courses, you can click on either of the last 2 sections on our Balance Method Overview page to view them. I will click on the last one, Explore Dr. Tan's Courses. Here you can view Dr. Tan's 15 exclusive courses with eLotus. You can also click into each class to learn more. If you want to access all of his teachings and unlimited CEUs for a whole year, our Gold Pass is the ultimate TCM membership to unlock generations of wisdom and knowledge. I will put the link to our Gold Pass shortly. I hope this helps you navigate our new Balance Method course section, and I will send a link to this page again for you. Now let's get started with today's webinar.
Dynasty. A lot of doctors come out and say, oh, every problem comes from the spleen and stomach because there are more pores in that category. Okay? More categories pores belong to elements earth. That's why. Okay? And of course, they also, because spleen and stomach, digestion, if you don't have a good digestion, good absorption, there's no chi, blah, 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 blah. They all this kind of a discussion about it, okay? So just let you know that. Patient walk in with sprained ankle from the source on dancing. On the right side, what should you do? Wonderful. 1, 2, 3. Diagnose 1. Again, we go back to the same example. Gallbladder 40, which is what? The foot shaoyang on the right side, ankle pain. System 1, you use what? Sanjiao 4. We've been through that, right? System 2, which point you should use? You say, I don't like the number 1. hate a number because since I was born, my mother always wanted me to be number one. I hate that. Okay, let's do number 2 then. All right. You can look at the note and cheat. Okay? Or you can look at this book, okay? System 2 to treat this problem. Who can balance gallbladder? Heart. Beautiful. Which point then? After we determine use heart, we're going to use an upper limb, right? That is a hand meridian. Which area in the hand meridian can balance the ankle? The wrist. And we already decided heart. So the answer is what? Heart 7. That's the wrist point of heart to treat the ankle. You can do right side or left side. That's the beauty of this system. Using the yin, treat the yang, and either side. You say, my lucky number is 3. How about that? Fine, use system 3 then. System 3, who balance gallbladder channel? Liver. Where you gonna stick the needles in? Ankle to ankle. Liver 4. And you say, I love Chinese clock. It's my favorite. Fine. On the Chinese clock, who balance gallbladder? Heart. Same as system 2. Heart 7 is the answer. How about system 5? Who balance gallbladder in the neighbor? Same as system 1. Share the same name, remember? That is what? Sanjiao, and Sanjiao 4 is the answer. How many strategies you can treat this ankle pain? 3. 3 choices. Isn't life so beautiful? You have more choices. Life sucks when you don't have a choice, okay? You have to do the certain thing without choice. You're stopped. But here you have choices. Which one work better? I don't know. You need to experiment on your different individual patient. It's very individual. Patient A maybe work the best from system 2. Patient B maybe system 1. Experiment. When you are practicing what you learned today, I suggest you to stick with system 1 for 6 weeks. Until you're familiar with it, move to system 2 for 6 weeks. Okay? Otherwise, you will be wishy-washy. Oh, which one I should go? Okay? They all work. You stick the needle in. If the ankle pain did not happen, any change. If there's no change happening, don't bother call me at my office, please. Oh, I have a patient on table now. Dr. Tan, your point didn't work. Don't do that, please. Okay? If it didn't work, blame on yourself. You didn't make it work, idiot. Okay? Which part you didn't make it work? You misdiagnosed. The step 2 and 3 always work. When it doesn't work, usually the problem is from step 1. You might not carefully check which meridian is sick. Maybe the meridian the patient have a problem, the strain, the pain is in between gallbladder and stomach. You've got to be very careful to identify that. When that happens, you treat in between. For example, if you system 1, you have to pick a point in between Sanjiao 4 and large intestine 5. Make sense? Because in between Shaoyang and Yangming. If in system 2, you have to in between heart and pericardium. Because pericardium balance stomach. If you use a system 3, in between spleen 5 and liver 4. That's your choice. Okay? Got it? So many times it didn't happen. It very likely is what you're diagnosed. You missed it. Sometimes what? Yeah, you can needle into the tendon, or you can do the different angle to avoid the tendon. Up to you. Acupuncture the most preference of your treatment. Okay, the best. Palpate around. But don't forget, is not necessarily only on the surface. You need to feel deep inside. Where? Location, deep in there. Where should I penetrate? And you just need to make your needle tip go in there. Okay? Treat what? Yes, you can do that too. Yeah, but if one system already make it work, don't bother do the second. The more needle you throw in, not necessarily the better result you're going to get. Believe me. Okay? Keep your treatment simple. As long as the patient start to respond beautifully, leave them alone. Okay? Don't create more labels, right? Leave them alone. Yeah. Yes.
Have doctor proof that it's a herniated disc pushing directly on the side of the or nerve. Still works or something like that?
Yes, it's a hernia disc. If it's not a very severe situation, we can make the herniation recover. But of course, we're talking about the missing disc or the disc is totally protruding out. We still need to send them to surgeon. Okay? Unavoidable. Every medicine have their limitation. Okay? What is the best and most effective treatment from acupuncture, which other medicine hard to compete with? It's any kind of nerve disorders problems. Nerve pain. Okay? Secondly, is a body chemistry imbalance, such as hormone. We can treat it very well. Okay? Especially the nerve disorders. It's our cup of tea. No, fortunately, so far, no other medicine can compete with us in this area, right? Fortunate. That's why I always don't know some of the acupuncturists out there, they claim they are higher class acupuncturists because I don't treat a symptomatic pain. We have a lot of those, okay, out there. I don't treat a symptomatic pain. I'm better acupuncturist. I treat the root. Okay? I treat the bottom line. I don't treat a symptomatic pain. Okay? And they say that like they are much higher rank and class. But I just say, I don't know why they say that. To me, any acupuncturist, if you don't treat a so-called symptomatic pain, it's like somebody come to my house and want to be a housekeeper and telling me I don't do window, I don't do refrigerator, I don't iron, I don't even vacuum. Okay, then what the hell do you do? Right? Treating pain is the easiest thing. Okay. You want to be practical too. Treating pain can make you so competitive. because nobody else, okay, in other medicine can compete with us in treating pain yet. And I'm not saying only numbing the pain, I'm saying get rid of the pain. If you don't graduate a patient, you don't practice well. You don't build up your practice. Believe me. Every week in my office, if I don't have 10 more new patients, I'm in trouble. Because I'm not going to be able to pay my bills. Why? Every week there's 10 patients graduate. Okay?
There are so many areas that are in pain. Do you treat them all at once, or you pick the most significant?
A question is, when you treat a patient have a many pain area, no matter it's from accident or whatever, okay? Yeah. What you do? Well, depend on your strategy. If you say, I want to handle all the pain in treatment once, and in a single treatment, I want to handle to treat all the pain, it's doable. 12 magical point. You have my book? Yeah, that's the part. Okay? It does work fast, but does not work as focused. That's what I'm not finished my statement. Second way of your logical thinking is, I'm going to focus treating only those severe pain. I might choose 1 or 2 or 3 meridian, and hopefully can be balanced by one single meridian, more focus. 12 magical point is so magical. To treat a fibromyalgia, everywhere pain. To treat an accident pain, to treat an injury pain, everywhere. But what is the disadvantage of that? When you can do general, you are not focused. This is the fairness of the universal rule. One side, you gain one side, you lose other side, always. Okay? So you want to do general, okay? Then the patient don't get as much relief as you do focus. Okay? Let's practice another one. This one, let's say patient come in and say, I have a right side knee pain from ski. Big fall from ski. Right side knee pain. As an acupuncturist, what should you do? All right. Diagnose. First step in acupuncture way. What is done? Identify which meridian involved in the knee. How many meridian in the knee?
6.
Beautiful. 太阳、阳明、少阳、太阴、少阴、厥阴. We have used that for thousands of years. The patient say, my knee pain is right on the side of the knee. A typical ski pain, right? People usually make a turn of the long ski. When they fall, they twist it there. What is your diagnosis then? Foot, Shaoyang, gallbladder 33. That's your diagnosis. Agree? Step number 2, balancing them. How many choices you have? 5 systems, but the 3, because 2 of them overlap in this case. Why do I know? Because I have done this for so many times. System 1, who balance foot Shaoyang again? San Jiao. Same as the sprained ankle case. You see that? Why I do that? I purposely give you the same meridian problem, but different location. That's why I say point is not important. The strategy, who is balancing, the meridian we choose is most important. So we're going to use Sanjiao for system 1. We're going to use heart for system 2. We're going to use liver for system 3. Same thing. Only the point change. We're going to use elbow and knee, treat the knee. So when we do Sanjiao, we do what? Sanjiao 10. When we do heart, we do what? Heart 3. That's the elbow, right? When we do liver, we do what? Liver 8. I'm doing it fast now because I'm showing you what exactly I do every day in my clinic. Go, go, go like that, okay? Determine one meridian, determine where the needles go, put the needles in, shut the lights off, tell my patient, good night, have a good sleep, and I walk out, okay? Some of you maybe criticize me, say, you are not a good doctor. I spend 2 whole hours with my patient. And you want my real life experience with you? I give you advice, don't do that. You want to build up your practice, you want to graduate your patient, don't do that. Early time, early stage, when I'm only seeing 5 patients a day, I stick the needles in, shut the lights off, I walk out and start to install my cabinet and my shelf. Zzz, boom, boom, boom. In other room, because I'm not finished yet. Leave them alone. Even I was seeing 5 patients a day. I don't spend the whole time with my patient, hold the hand and look at the hair and do this and pat the shoulder. Who are you? Okay. A patient always say, poor me, help me. You think you are a good doctor that way? Not necessary. Why I say that? It's not only my own experience. Because I have so many apprentices. They followed me for years. And they go back to build up their own practice. They don't do what I do there. They do their own way, by their own belief system. They do this, I call it woo treatment, okay? Ooh, you're so poor. Ooh, I feel sorry with you too. I call it woo treatment, okay? And sometimes, oh, let me give you my chi. Oh, so good. The patient feel good in every treatment. Oh, so good because somebody give me so much attention and care and love. We do need to love the patient. I love all my patients. My patient love me back too. But I tell you, ladies and gentlemen, in reality, when you practice medicine, how do you love is more important. It's not how much you love. How do you love the patient? More important. You stick the needles in, damn it, it's your work. You walk out. Let it cook. Why? Then patient will get well that soon because the nature is going to healing this patient. Acupuncture is a phenomenon from the beautiful nature. It's not you. You are using this nature only. You're the messenger. You stick the needle in, apply the nature, apply the power, let it work. And those apprentices, they do the woo treatment for 2-3 years. They don't build up their practice, believe me. Until they realize, okay, I'm going to copy what Dr. Tan's doing. Throw the needles in and say good night. Shut the lights off, leave the patient alone, and walk out. Next. Okay? And I tell you, beautifully, they graduate patient after 10 treatment, averagely. That's the average number. Many people came to me during the break. Average, how many treatment you give the patient? 10. Okay. But the span is so big, so dramatic. Some patient, one treatment, they're done. No more problems. The longest time I treat a patient is 78 treatments. Okay. But I saved her leg from amputation. They're going to cut the whole leg off because no circulation, artery blockage. We treated 78 times. The leg function normal. Okay. First 30 treatments, 3 times a week. Okay. And then we cut down to twice when she's improving, and then once. We spread them not kind of even. Okay.
Do you ever treat them?
Oh yeah. Somebody is coming in with a severe injury pain every day. I treat the patient. Okay. And I don't know who started this nightmare too in this country. Everybody was taught to treat the patient once a week or once every 2 weeks. Don't do that. If you do that, you don't get the job done ever. Get your job done. Okay? Graduate the patient. Right? Get it done. All right? Why I share this with you? Because I have 2 different kind of practice. Somebody still ooh, okay? Somebody give up ooh. And those groups that they give up ooh, they are as busy as I am now. Okay? It's one of my apprentices. She actually is not really my former friend, but he has been so many class. He's one of my favorite students. His practice very close to here. His name is Bob Dong. Anybody heard his name? You heard his name? 50 to 60 patients a day, right? There's no time for ooh. Okay? The faster you treat the patient, the less number of time you spend with the patient get better faster, believe it or not. Why? Because you are letting nature doing the work. Okay? Don't take over the power of the needle. All right? So that's my experience sharing with you. It's a reality. On the contrary, a lot of people spend the whole time with the patient. After 4 patients a day, they just totally burned out and exhausted. Oh, why? Because the patient keep on take from you. As a good, healthy practitioner, we don't do that. All right? It's one reality I share with you. Another thing I want to also play with is a patient coming with right side shoulder pain. What should you do? 1, 2, 3. Again. How many meridian go through the shoulder? 6. Beautiful. The patient saying my shoulder pain's right here. The hectic is every time I raise this way hurt. This way hurt. This way hurt some. This way okay. Where is this? Who governor here? I can come down here and follow this and make this 3 finger numb too. What is your diagnosis? Hand, Yangming, large intestine. Significant. Right? Hand, Yangming, large intestine. How do you treat it? System 1, who balance Hin Yangming? Foot Yangming. What is that? Stomach channel. Where are you going to put a stomach channel? hip for the shoulder, opposite side. Stomach what? 31, right? Yeah. Stomach 31, 24 point again. What do you said? If I do system 2, who balanced the shoulder? Liver. In where? In the growing area. That's the point. Liver 11, 12. Okay. System 3, who balanced stomach? Good. Because you did not miss track by me. Lung balanced large intestine. Okay? So lung 2, Usher. Right? System 4, who balanced the large intestine again? Kidney. Where? Kidney growing area. System 5, who balanced large intestine? Stomach. How many choice you have? 4. Life beautiful? Yes. That's what I do every day. Like playing games, playing puzzles. Find a balance for the patient. We have not talked about the reverse image yet. Okay. Now I'm going to confuse you now before lunch so you can think about it. Give you a little bit digestion, okay? We can reverse the image too. That means always can upside down. Under that circumstance, the ankle joint become the shoulder joint. The elbow still relate to the knee. Okay? And the hip joint become the wrist. See that? Upside down. In your textbook, you learn the one famous point to treat a shoulder problem. What is that? Stomach 39, remember? 38? No, 38. Why? Empirical? That's a reverse image. Stomach 38 can treat the muscle shoulder pain on the stomach channel here. If you really want to do the shoulder joint, you'd better do stomach 41, because that's a joint, okay, instead of stomach 38. What if the patient have a neuropathy in the toe? In the afternoon, we have a more complicated problem. Okay, now before lunch, we just do very simple, straightforward stuff. Okay? Neuropathy in the toe. Numbness, not necessary pain, tingling. What should you do? All the toes. No big deal. Through the needles opposite side of all the fingertips. Why you laugh?
Welcome back, everyone. I hope you're enjoying today's webinar so far. I have a question for you. What inspired you to become an acupuncturist? Was it the desire to heal yourself? To help those around you? Maybe because you believe in the power of holistic medicine when Western medicine fell short? At the heart of it, we all share the same dream: to be healers, to have thriving clinics, and to have the knowledge and confidence to treat any patient who walks through our doors. And that's the key word: confidence. We don't want to just put pins in and pray for the best. That's what Dr. Tan called prayer acupuncture. We want to practice with certainty, knowing that our treatments will work. If this resonates with you, then I'd love to take a minute to share about our amazing eLotus membership that has helped thousands of practitioners over the last 20 years reach acupuncture mastery and create the practice of their dreams. As much as we wish we could fit all of Dr. Tan's teachings into our weekday webinars, he left us with such an incredible amount of wisdom that it's impossible to cover it all in just these 4 weeks. Over the years, Dr. Tan has taught 15 full-length classes with eLotus. That's 97 hours of video teachings and CEUs, covering the balance method, master tongue acupuncture, sports injury treatments, herbs, and so many live demos. In honor of celebrating Dr. Tan's balance method acupuncture, you can become a Gold Pass member for an exclusive price available only today. This is truly your chance to take full advantage of this promotion and invest in yourself, to access tried and true clinical insights from top practitioners to help you create the practice of your dreams. Imagine practicing with the mastery and confidence of Dr. Tan himself. Who needs prayer acupuncture now? And it gets even better. Along with full access to all of Dr. Tan's classes, over 3,000 hours of our eLotus library, and unlimited CEUs, there are also amazing perks waiting for you. Our sponsors, Helio Medical Supplies, is giving you 10% off all acupuncture needles. Our second sponsor, Evergreen Herbs, is giving you an herbal voucher for their most popular and exclusive collection formulas line. Yes, the exact value of the Gold Pass. Pretty amazing, right? So many practitioners have already transformed their clinics with his teachings, and you can too. Remember, we entered this profession for a number of different reasons: to heal, to grow, and to become master acupuncturists. The Gold Pass will give you the tools to get there. And for those of you who are already Gold Pass members, we'd love for you to share in the chat how it has supported you in building the practice you've always envisioned. If you have any questions about the Gold Pass, please feel free to ask me in the chat room. I will include a link for more information for you. Thank you for letting me share this special news with you. This is such a special opportunity that I couldn't keep to myself. Now, let's jump back in and continue learning from the legendary Dr. Tan.
Your problem, ladies and gentlemen, again. A lot of times the acupuncture practitioner, they assume your patient won't like it because you are too chicken to get needled yourself. Oh, my patient won't like it. Believe me, once they put the needles in, the toes not numb anymore, they will love it. Right? We don't assume people like or dislike. It's because of yourself? No. Right? I use Jingwell point a lot in my treatment. They are powerful. What is the most quick and dirty way to treat a headache? Do you know? Any headache. Write this down. you'll be a hero. Lung 11, pericardium 9, heart 9. 3 points. Opposite side even better. That's the last topic I'm going to talk about before lunch. We go lunch 12:30, right? No? They say 1 o'clock. And then 2 o'clock start. In the afternoon, what time we start? Huh? 2? Okay. All right, then we have more time, okay? How do you treat a headache? Answer me, please. 1, 2, 3, same thing. Don't you ever doubt it, okay? 1, 2, 3. You think I make this a class title today just for fun? 1, 2, 3. How do you treat a headache? Diagnose where is the headache, which meridian involved. Patients come in and say, I have a sinus headache. Patient come in and say, I have a migraine headache. Patient say, I have a headache today, but it is not migraine like I used to have. Patient come in and say, I have the headache really just come out of from nowhere and out of blue. I never had a headache ever. To an acupuncturist, what you do? 1, 2, 3. To an acupuncturist, the regular headache, sinus headache, nerve headache, migraine headache, out of blue headache, no difference. Believe me. I don't care you have a sinus headache or migraine headache, because some patient will come in, oh, I have a headache today, but it is a sinus headache, it's not migraine. Sometimes they, oh, it's migraine, not sinus. To an acupuncturist, there's no difference. Why? We do 1, 2, 3. Where is your headache? That's the most important thing. Right here. The patient say, my sinus headache today is right here. On the left side. What is your diagnosis? Gallbladder. I don't care what headache. It's a gallbladder headache to you as an acupuncturist. Question?
Someone who has headaches that are intermittent, say maybe once every couple of months, how do you treat them?
You still ask them where the headache in general.
If I mean, as far as you're not going to do 3 times a week, there's no headache
No,
that you're
no,
having.
no. Usually when they are intermittent headache, I treat them maybe once a week. But when I always tell them, when you have headache onset, don't wait. Come in right away. Call my office, say I'm here. Okay? I'm going to be there in minutes. Don't wait. Because that time you can diagnose so precisely. Okay? So every time when I treat my patient, if they come in and I have the pain, I have the headache now, I always say, great. They look at me like I'm weird, okay? Because I knew when that moment they have the pain, I can diagnose more precisely. Besides, my treatment strategy will be more precise. Why? Once I stick the needles in, if they have headaches gone, I know I did it right. I don't need to wait for next episode. Okay?
Something has on with, say, wrist pain with a certain motion. Do you do whatever we have them?
I insert the needles, let them regenerate the pain. If a certain motion have a wrist pain, then I say, okay, I put the needles in and then say, try that again. If the motion, no more pain or less pain, good, I know I'm doing it right. Then I say, please don't repeat it. Leave it alone, that is only for diagnosis. Okay? Headache right here, right? Gallbladder. How do you get rid of those? System 1, treat the sun jaw. System 2, treat the heart. Again, you see? System 3, treat the liver. That's it, because 4 and 5 are repeating. Where you put needle? Sun jaw 3 makes sense. The hand image the head. Heart 8 makes sense. That's why heart 8 make me famous in book number 2. Okay, 24 more in acupuncture. A lot of people use heart 8 before they meet me. Okay, fine, you see the magic there. Why I use heart 8 as my promoting point of balance method? Because human beings' head are more covered by gallbladder. Okay, once you use heart meridian, you balance 1/3 or 2/5 of the head. No doubt. That's why I dare to use heart 8. What if the patient say, my sinus headaches right here? What is your diagnosis? This is urinary bladder. Okay. You're going to balance urinary bladder, use small intestine. Taiyang to taiyang. Urinary bladder balanced by lung. Okay, tie in to taiyang. Urinary bladder going balanced by kidney, system 3. Urinary bladder going to balance by lung, Chinese clock, opposite side. Urinary bladder going to do small intestine, same thing as system 1, Chinese clock, neighbor. 3 choices in the hand. What if the patient say, my sinus headaches right here? What is your diagnosis? Stomach channel. See that? That's why you pay $50,000 for. To identify this. It's a foot yang means stomach channel. Okay. Later on, let me finish this, okay? Who can balance stomach? Look at your note. Yang Ming balanced by what? Yang Ming, large intestine. System 2, who can balance stomach? Pericardium. System 3, who can balance stomach? Spleen. Chinese clock, who is the opposite side of stomach? Pericardium. Okay? Chinese clock, who is stomach's neighbor? Large intestine. How many choice? 3. Simple. Now, go back to my quick and dirty way. Why we use lung 11? Number 1 is in the hand, is in the head. Image. Number 2, I'm using double image. I'm using the phalangeal, this segment of the body, the phalangeal, to image the whole head. See that? This segment is the whole head. Any cell can image the whole body. Called a what? Hologram. All right? Take care, gallbladder headache. How many meridian in the head? 6. Don't hesitate to answer that number, please. But again, this time it's not 3 yang, 3 in. 6 meridian head are all yang meridian. I just stated lung, pericardium, heart. You balance the gallbladder, stomach, and UB. Besides that, heart can balance small intestine. Pericardium can balance sanjiao. Lung can balance large intestine. They are all in head. That's why we chose that 3 Jingwell point. If you don't believe me, you can treat yourself if you have headache. Or you use toothpick, okay? To penetrate those points. All right. How soon the patient feel the headache is better? 6 seconds. But when the patient's on your table, they will feel the headache come in and out like waves. Okay, like waves. Comes better and better, come down better, and then the waves become more and more stable. As long as the time goes by, you want to see the patient walk out your clinic, there's no headache. Okay? Yes. One hand, good enough. Mostly, if you can identify the side, the opposite side work better, okay? You can do either way. You want to do nail corner, Jingwell, or the tip of the fingers, fine. But I usually do nail corner, okay? Yeah? I like use Jingwell point these days myself. You know why it's so handy? Gallbladder 31, you have to ask the patient to take the pants off, you know? Yeah, so I do it so handy. And they work, and the other thing, they are handy and effective. The effectiveness will be competitive with gallbladder 31. That's why I like it, right? Okay, before lunch, we're going to do one other thing. It's called Dr. Tan's 8 Magic Point. I almost wrote a book for it and sell you for $25 again, okay? But since you pay for the class, I give you for free, okay? Treat what? All kind of digestion problems. Stomach 36, gallbladder 34, or my points. Liver 8, or my points. Spleen 9, lung 7, P6, Sanjiao 5, large intestine 4. Done. Quick and dirty way, treat all kind of digestion problems. You name it. Irritable bowel syndrome, constipation, diarrhea, nauseous, bloating, diverticulitis, duodenum problems. What? Heartburns, you name it. Morning sickness, vomiting. Very handy. Some people say I don't like it because, you know, Sanjiao 5 is my favorite point. It's on the right side of the body, and I am a Democrat. I hate right wings. I say, fine. Don't be so excited, okay? You can switch side by your political preference, right? Don't ask me what you do if you're in the middle. You artificial choose one side. Any side is fine. Okay? I know you're in the middle. That's why I tell you that. Really? Okay. Let's check for balance. I'll tell you, okay? Just sun job balance with pericardium. Agree? Large intestine balance with lung. Agree? System 3, body relationship. Lung balance with spleen. Agree? Tie in to tie in. Pericardium balance with liver. J in to J in. Sun job balance gallbladder. Shao yang to Shao yang. Large intestine balance stomach. Agree? Yang Ming to Yang Ming. Spleen balance stomach. Agree? Yin Yang Biao Li relationship. And liver balance gallbladder. Agree? Yin Yang Biao Li. Sun jiao balance spleen. Agree? Oh yeah, because the Chinese clock opposite side. Okay? And pericardium balance stomach. Agree? Chinese clock opposite side. Balance everywhere. See this? In engineering, we call it structure of trust. That means it's perfect balance. That's why you see this structure everywhere in the building and also the bridge, underneath the bridge. You see those steel bars, they all structured this way. Every direction, everywhere balance. The patient has to get better. They have no choice. There's no order. She has to throw the needle in. Quick and dirty way. Okay. Where is Dr. Tan's gallbladder point? Posterior, inferior. Posterior, superior to gallbladder 34. Right at the attachment of the tendon to the condyle of tibia bone. Fibular bone. Fibular bone. The little bone head right there. There's a tendon attached to it, posterior to the regular gallbladder channel. The little condyle of fibular bone below the knee, almost to the back side of the knee. It's a little attachment of tendon. You rub that area, you feel the electricity feeding down to the foot, as if you are penetrating pericardium 6. That's a better point than gallbladder 34. If the patient has the shooting feeding, even better, okay? Where is my liver point? Anterior to spleen 9, right on the medial condyle of tibia bone. Whole area is mine. I'm greedy, okay? It's like a dollar sign, dollar coin size. Whole area on the tibia bone, medial side of tibia bone, anterior to spleen 9. You do oblique treatment like you penetrate liver 5. Oblique. That's a better point than liver 8 itself. I use that a lot in clinic. Look image here. Stomach 36, treating what? Anywhere above and below the navel. Because you can reverse the image. 36 can be above the navel because it is below the knee. When you see the image, if the foot is ahead. Agree? Also, if you reverse the image, stomach 36 is below the navel. That's why stomach 36 is so powerful to treat all kind of what? Digestion problem. Okay? And you can look at all the point distribution there. You can see we are covered so much in the trunk digestion area. That's why they all work. And when they put together and balance each other, they work even more powerfully. It's my lifetime essence. I come up with this idea myself. It's my invention. Okay? Nobody ever put this together as a strategy to treat all kinds of digestion problems. If you study this book, the first 42 pages, part 1. If you really studied it, you practice it, you know them by heart, you will be the top 10% acupuncturists in the world. I mean it. Only 42 pages. But you want, you're shaking head. But you want to be master of this 42 pages, it take you 2 years. Okay, my estimate, right? Agree? 2 years. Okay. That's how I write books. I don't write big books, right? Small book, but like eating jalapenos, right? It's very strong taste. Okay, it take a long time, okay, to be master of the first 42 pages. Okay, I write it simple, but it's very applicable in the clinic. Part 2 is my invention. Okay, that's a higher level to treat all kind of complicated problems. But I suggest you do the part 1 first. Okay, that's very important. I think my microphone out of juice, right? Why don't we take a lunch break and come back earlier? Okay, can we do that? Okay. All right, tonify your spleen, please. Dynamic balance pattern, okay? Dynamic balance. If you have been my other curriculum, I do use about half an hour to 1 hour to explain what dynamic balance is by the I Ching, the Tai Chi, the yin-yang attraction, remember? But today we're not in that curriculum, so I just give you a little bit, just a protocol, what we call by dynamic balance, okay? Usually when we treat a patient, we like to do the yin-yang like this. In the morning before we take the break, you remember I give you the 8 magical points to follow the dynamic balance pattern. That means if on one side on this limb, we use all the yang channels, then we do the yin channel on the other side. And here we do yang, here we do yin. The pattern is, it's a Tai Chi attraction. The yang is attracted with the yin attract with the yang attract with the yin attract with the yang attract with the yin attract with the yang attract with the yin. Some people say, give me a break, when you're going to stop, right? I say, I never want to stop, because that's the beauty of the nature. No matter what, if a relationship, if a dynamic is between the yin-yang attraction, it lasts forever. Okay? Because what? The summer attract the spring attract the autumn attract the winter, the winter the spring, and keep on going. It's yin-yang attraction. So when we treat a patient, we want to create a picture like that. That's why in treatment, I very seldom use a symmetric bilateral treatment. I call it dynamic balance because there's attraction there. It's not a static balance. If anything is a static balance, it won't move. You only use the yin attract the yang, yang attract the yin attract the yang, it will continue move. That's why we call it dynamic balance. Just like you ride a bicycle, when the bicycle stops, there's no dynamic anymore, the bicycle will fall. But the bicycle keep on going, okay, rolling, then there will be dynamic balance. You will maintain the balance, you won't fall. And you can do this too, you see that? That's what we mean dynamic balance. So in this afternoon, in many cases, you will see I use the concept of dynamic balance, just like in the morning. See, yin channel, yang channel, yin channel, yang channel. You see that? The dynamic balance is not symmetric. Okay? Destroy what? Hmm?
You said, you know, where you plug the leads up and
The order?
electricity? No, electricity. Use electricity.
Oh, you mean you hook up with electricity?
Yeah.
I don't do that. Or you mean the positive with yang or negative? Doesn't matter. It really does not matter. Okay? But I don't use electricity myself. Okay? I have electricity device in every treatment room. They all rusted now. I'm not using it for more than 10 years. Okay? I don't need them anymore. Okay? So this is the pattern. We call it dynamic balance. So when we say dynamic balance in the class or on the forum, when people type in dynamic balance, you know what they're talking about. Okay? When you log on my website, the forum, if they say BM, don't think it's bowel movement. Okay? It's a balance method. That's what they mean. Okay? BM. All right? Not a bowel movement. Okay? The balance method. Okay? All right.
As we wrap up today's session, I want to leave you with something special. Our eLotus team has gathered Dr. Tan's invaluable teachings and made them available on Core, as well as in our clinical manual. Dr. Tan personally outlined his top treatment points for 100 of the most common problems seen in acupuncture clinics. And now, all of that knowledge has been preserved by our eLotus team and passed down to you. You can access Dr. Tan's top treatment points in the links I will share with you in just a second, along with your login information to access our clinical manual. Thank you so much for joining us today, and we hope you leave with new insights and inspiration. And if you found this webinar valuable, please share it with your colleagues. And we look forward to seeing you at our next webinar.